Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So your GP suggested you bring Tony in?
Yes, we've had a very bad night. He's had hardly any sleep, wheezing, out of breath and coughing. I was really worried, so I rang up Dr. Cooper.
Does he use a blue inhaler?
Yes, he's had one for years.
But it didn't help?
Not this time.
Is his asthma normally under control?
Well, he's had it since he was 4. I was worried about him going to school at the start, but he seems to manage most of the time.
Have you any animals at home?
No, he wanted a pet, so we got him a cat, but it made his condition worse, so he had to give it away.
Have you noticed if he's allergic to anything else?
Well, we try to keep dust down in the house.
Who did you see about Tony's asthma in the first place?
We were sent to St. Mary's and he had lots of tests to see what he was allergic to.
And what were the results?
Oh, he was allergic to lots of things.
So he was put on Intal, was he?
Yes, he took that for years regularly, but a year ago his asthma got worse and our GP changed inhalers.
Does he now use a brown inhaler?
Yes, he uses it regularly.
Is there anyone else in the family with hay fever, eczema or asthma?
Oh yes, my mother had asthma all her life. I had eczema as a child. On my husband's side, several people have hay fever.
Has Tony had any illness apart from asthma?
No, fortunately not. That's enough.
Has he ever had to come into hospital before with a similar attack to today's?
Yes, they put him on steroid tablets. Another time, he was rushed into intensive care and put on a machine to help him breathe.
Has he a nebulizing machine at home?
Yes, and a peak flow meter. The asthma nurse showed us how to use it.
What is Tony's usual peak flow rate?
300.
And what was it today?
100. He's been very restless all night and breathless. He took more and more puffs, but he's just the same.
Does anything special bring on one of these attacks?
It seems to be when he gets a cold.
That's very common. Well, Tony, I'm going to bring you into hospital to get you sorted out, all right?
Thank you, Doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Michael. Come on in and take a seat. My name is Jean Matthews.
Hello, Doctor.
Well, can you tell me what's brought you here today?
Well, to be honest, I haven't been feeling well for the past week or so.
That's no good. What sort of symptoms have you had?
I've had a fever for a few days. It comes on worse in the afternoons as well. I have been feeling a bit nauseous as well.
And are you taking anything for that? Panadol, things like that?
No, I haven't. I've just been trying to tough it out.
Okay. And what about your eating habits? Have you noticed any change to your appetite?
Well, I don't seem to be as hungry. I haven't been able to complete my meals without feeling a bit sick.
And with the nausea, has it ended up in vomiting?
Yeah, I did vomit actually, both yesterday morning and this morning. That's one of the reasons I thought I'd better come and see you.
Okay. And what about any other aches or pains generally?
I'm feeling little bit tired, and I've had a few pains in my joints, and I've been a little bit stiff in the mornings.
And have you noticed any other sort of changes, such as yellowish skin or in the whites of your eyes?
Well, I didn't, but my wife commented this morning that she thought my skin had turned a bit yellowish.
And what about the colour of your urine? Any changes there?
Now you mention it, I do think it's become darker in colour.
Okay, we'll see. Now, Michael, I'd just like to get some background details before we go any further. Could we start with your age, please?
I'm 38.
Are you married?
Yes, I am.
And any children?
Yeah, I've got 2 children.
And how old are they?
I've got a daughter who's 9 and a son who's 11.
Oh, lovely. Okay. And what about your employment? What sort of work do you do?
I'm a carpenter by trade.
I see. And you work mainly on building sites and places like that?
Well, I do work on building sites, but the company I'm currently working for now has quite a few overseas projects, so I do go overseas quite a bit with my work.
And whereabouts have you worked recently?
Well, this year I've been to East Timor, and I've just come back from New Guinea about 10 days ago.
I see. Okay. And just tell me a little bit more about your general health.
Well, pretty fine, I think. I eat healthily, and I haven't had any complaints.
And do you smoke at all?
I do smoke, but I try to keep it under control. I suppose I smoke about 10 cigarettes a day.
Okay. And what about alcohol?
Well, I have a couple of beers most days, but my wife and I are trying to be responsible and have a couple of alcohol-free days each week.
Well, that's an excellent idea. Okay. Very good. And now, just to go on to your family history, what about your parents? Are they in good health?
Yeah, they're both in quite good health. My father, he retired a couple of years ago, but he's fine. And my mother, she's well. She does have high blood pressure, and she does take some medication for that, I believe.
Okay. And do you have any brothers or sisters?
I've got 3 sisters, and they're all well.
Okay, good. Well, Michael, your blood pressure is certainly excellent, and you're not overweight.
I'm pleased to hear that.
But what I do think, based on your symptoms and the jaundice and everything you've told me, I'm a little concerned that you might have hepatitis A.
Really?
Well, this is not something to be greatly alarmed about, but it may be connected with your overseas travel. It's spread through fecal-oral transmission, and it may be that you've touched something and that's been contaminated, for example.
So, you think I might have picked this up on one of my overseas trips then?
Yes, it's very possible. When you travel, do you eat the local foods?
Well, actually, because I do travel a lot, I am aware of the risks, and I'm very careful with what I eat. I try to only eat food from the hotel, and on this particular trip I didn't eat out in the marketplace, and I always drank bottled water.
Okay. Well, look, I'm sure you did take proper precautions, but even when we do this, it's still quite possible. Sometimes the hotel staff may not have practiced the level of hygiene required. They might have touched utensils or food that you've eaten, and that's how this can be picked up. So.
I see. Well, this is a real nuisance for me, Doctor. If I've got this hepatitis. What can I expect to happen now?
Well, the first thing we need to do is confirm this diagnosis, and for that you'll need to take a liver function test.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear 2 doctors talking about risk factors for kidney donors.
Now read the question.
Doctor, how risky is donating one of our kidneys?
Well, there is an online risk tool to calculate the long-term risk of end-stage renal disease in people who are willing to offer kidney donation. This tool includes many characteristics in contrary to single characteristics used earlier. This multitude of characteristics help develop a comprehensive picture of risk in donating a kidney. This tool incorporates 10 different characteristics that are specific to the person willing to be a donor and provides an estimation of the absolute risk of end-stage renal disease over a certain period of time, say 15 years.
Question 26.
You hear 2 doctors discussing dysphagia after the use of breathing tubes in ICU patients.
Now read the question.
Hello, doctor. Is trouble with swallowing common following use of breathing tube?
Breathing tubes are meant to save lives, and they are often used for critically ill patients as well as during various surgeries. However, using breathing tubes has a side effect of difficulty in swallowing called dysphagia. In the ICU, patients had breathing tubes down their throat, typically more than 48 hours, will have a minor difficulty of swallowing and some voice problem as the tube is pulled. If it becomes worse, it can last years afterwards. According to the findings, most patients in this 5-year study recovered from their dysphagia within 6 months. However, there are also cases of the condition lasting up to 5 years. The good news is that even in patients with the prolonged periods of dysphagia, ultimately they did recover some function.
Question 27.
You hear 2 doctors talking about why primary doctors should not perform eye screening.
Now read the question.
Doctor, why shouldn't the primary care doctor perform eye screening of the patients?
Well, according to the recent recommendations of the United States Preventive Service Task Force, the primary care doctor shouldn't include a vision screening to the list of primary tests for his patient in his office. To know why vision screenings may not trace out the precise vision impairment, we need to look at the factors that can restrict the effectiveness of the results. Many vision screenings are performed only for distance visual acuity, and it does not give any indication of how well the eyes work together or focus up close. It also does not give any detail about the eye health. Although certain screenings may include a plus lens test for farsightedness and eye coordination tests, even these screenings will often fail to detect many vision defectiveness. Often, a vision screening is conducted by primary doctors or administrative personnel who have little training, who haven't the complete knowledge to assess screening results, even if the screenings are performed in pediatrician's or primary care physician's office. The scope of vision screening may be restricted by the type of lab equipment.
Question 28.
You hear two doctors discussing occupational therapy for improving visual function.
Now read the question.
Doctor, can visual function be improved through occupational therapy?
Well, findings proved that occupational therapy for patients with poor vision performed at their home and directed particularly toward helping them with both meaningful and challenging tasks, helped avoiding depression that actually improved the visual function as well. It was observed that those with milder visual impairment actually performed much better on these questionnaires after the occupational therapy group, whereas those who were in the supportive therapy attention control group could not improve their visual function measures. Therefore, the occupational therapy role not only improved in some of these depressive symptoms, but also in this specific subset of patients with mild impairment did improve their visual function as well. The comprehensive approach to rehabilitation, including in-home occupational therapy for those with visual impairment, is the key to improving visual function.
Question 29.
We'll hear a nurse explaining about spillage management.
Now read the question.
Spillage on fabric or carpet surface, e.g. sphygmo in the clinic. Put on the gloves. Dispose of wrapped, remove any glass as broken glass. Using the scoop, push the globules of mercury together so that they form large globules which can be collected using the syringe. Transfer the waste mercury to the waste container. When only the small globules of mercury remain, take the alloy wool and pull off piece about 2.5 centimeters, 1 inch, in diameter. Using the alloy wool like cotton wool bud, dab it onto the remaining mercury. Allow the wool to remain in contact with the mercury. Do not press hard or you may force the mercury into the pile of the fabric. You will see the mercury filling the gaps between metal strands as it forms an amalgam. The alloy wool bud will hold the mercury. When it does not pick up anymore and the mercury drops out again, use another piece of alloy wool. Place the contaminated wool in the waste container. Cap the waste container tightly and return it to the spillage kit.
Question 30.
You hear two doctors having a discussion about chemotherapy for bladder cancer.
Now read the question.
Doctor, could chemotherapy inside the bladder reduce recurrence of cancer?
According to a recent study, patients who had the chemotherapy drug gemcitabine placed inside their bladder following the resection of the tumor had fewer recurrences. Put of more than 400 subjects, 384 completed the trials and were included in the study, which randomized them to receive the chemotherapy drug called gemcitabine. To treat the bladder cancer, they implanted it into the bladder and let it settle there for an hour, and the other group with saline without gemcitabine in it. They kept the patients under observance for every 3 months for 2 years, thereafter every 6 months for another couple of years. What they observed was the recurrence were 34% less. The purpose of this study was to prevent bladder cancer from invading the muscle wall of the organ. Moreover, this is a very simple method without any significant side effects.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
You will hear a presentation by a consultant regarding Tourette syndrome.
You now have 90 seconds to read questions 31 to 36.
Tourette syndrome is a type of neurological disorder characterized by involuntary tics and repetitive vocalizations. Latest research indicates there may be as many as 1 in 200 people affected in Australia. It commonly affects people between the ages of 2 and 21 years, with the majority of cases occurring in children aged 4 to 12 years. More boys than girls are affected. Milder forms of Tourette syndrome can be misdiagnosed, as it often occurs at the same time as attention deficit hyperactivity disorder, obsessive-compulsive disorder, and conduct disorder. This condition commonly appears first between the ages of 2 and 12 years. For some sufferers, there may be a lessening of symptoms in late adolescence. It is, however, a lifelong condition that is not degenerative. Most children with Tourette syndrome are able to exert temporary control over their tics and vocalizations, while others require a cocktail of medications. The cause is mysterious, but theories include bacterial infection, abnormalities in the metabolism of brain chemicals, and genetic factors. Since stress and emotional overexcitement seem to exacerbate the condition, learning relaxation techniques can help. Whether or not Tourette syndrome is linked to other disorders, such as attention deficit disorder or learning disabilities, like dyslexia, is still undergoing scientific debate. Sometimes the disorder can spontaneously resolve for unknown reasons. There is no cure. Symptoms. The symptoms of Tourette syndrome can differ from one child to the next, but may include a variety of tics, such as eye blinking, shrugging, and facial grimace. Milder forms of Tourette syndrome can be misdiagnosed, as it often occurs at the same time as attention deficit hyperactivity disorder, obsessive-compulsive disorder, and conduct disorders. At least one involuntary vocalization, such as grunting, sniffing, or barking, that is repeated over and over. Attacks of tics and vocalizations, either daily or regularly. In some children, other behavioral or learning difficulties, such as dyslexia or obsessive-compulsive behavior. Appears between the ages of 2 and 21 years. A waxing and waning of the symptoms over several weeks or months. Simple and complex. Tourette syndrome can be mild, moderate, or severe. The intensity of symptoms can change within the individual, sometimes on a daily basis. Stress or tension tends to exacerbate the condition, while relaxation or concentration eases the symptoms. Sometimes the symptoms come and go over a period of months. There are two broad categories of Tourette syndrome. These are simple, a milder version which includes tics such as blinking, sniffing, shrugging, and grimacing, and vocalizations such as grunting and clearing the throat. Complex, a more severe version which includes jumping, spinning in circles, and compulsively touching things, and vocalizations such as repeating words or sounds, echolalia, and swearing, coprolalia. Theories on what causes Tourette syndrome. The exact cause of Tourette syndrome remains a mystery, but research is focusing on a number of possibilities, including genetic factors. Tourette syndrome seems to be an inherited condition. A child of a person with Tourette syndrome has a 50% chance of developing the condition themselves. Boys are 3 times more likely to inherit the condition than girls. Streptococcal infection. The Streptococcus bacterium can cause a wide range of infections, ranging from mild to severe and life-threatening. One theory proposes that a particular infection may be responsible for the neurological changes. Neurochemical abnormalities. The chemicals of the brain, neurotransmitters, seem to be metabolized differently in people with Tourette syndrome, especially the mood regulators, dopamine and serotonin. Other disorders. Researchers are divided on whether Tourette syndrome is associated with other disorders, such as attention deficit disorder, learning disorders, including dyslexia, and obsessive-compulsive behaviors, although they often appear together with Tourette syndrome.
Extract 2, questions 37 to 42.
You will hear a talk based on an essay published by the Public Library of Open Science on the topic of global affordability of fluoride toothpaste.
You now have 90 seconds to read questions 37 to 42.
The karyogenic potential of diet emerges in areas where fluoride supplementation is inadequate, such as in many developing regions and countries of the world. There's no doubt that dental caries is a global health problem and has a significant negative impact on the quality of life, economic productivity, adult and children's general health and development. What is worse, untreated dental caries in preschool children is associated with poorer quality of life due to the discomfort and difficulties in ingesting food, and this can result in a failure to gain weight and impaired cognitive development. This situation can be very distressing for families, and regrettably, since low-income countries do not have sufficient funds to afford dental restorative treatment, combined with the fact that they are most vulnerable to the impact of illness, then it's fair to say that they should be afforded a greater degree of protection. By World Health Organization estimates, 1/3 of the world's population have inadequate access to needed medicines, not because of education levels or location, but because they cannot afford them. Despite the inclusion of sodium fluoride in the WHO's Essential Medicines Model List, the global availability and accessibility of fluoride for the prevention of dental caries remains a global problem. Now, the optimal use of fluoride is an essential and basic public health strategy in the prevention and control of dental caries, because dental caries is the most common non-communicable disease on the planet today. Although a whole range of fluoride vehicles are available for fluoride use, such as drinking water, salt, milk, varnish, to name a few, the most widely used method for maintaining a constant low level of fluoride in the oral environment is fluoride toothpaste. Equity pricing is another method of reducing costs. It's based on the principle that the poor should pay less for effective medication and have better access to effective medication. The price of fluoride toothpaste should be fair, equitable and affordable, even for poor communities. Moreover, the same brand of toothpaste should be available at different prices in different countries in accordance with the people's wages and purchasing power. Expensive ingredients and packaging is another area where costs can be reduced. Approximately 40% of the cost of production of toothpaste is related to the enclosing or protecting the toothpaste for distribution, sale and use. Another 35% is attributed to the ingredients, and the final 25% can be attributed to manual work involved in manufacturing the product.